Hello everybody and welcome back to Awkward Silences. Today we're here with Wendy Johansson, the co-founder and chief product experience officer of MiSalud. We're very excited to have you here today. We're going to be talking about centering identity and equity in health tech research. Thanks for joining us.
Awesome. Thanks for having me. Super exciting to be able to talk to other researchers out there about how we continue to make research equitable and actual practice from some companies like mine.
Awesome. We got JH here too.
Yeah, I feel like that description sort of implies that our healthcare system could maybe use some improvement, which feels true. So I'm excited to see how we can help do that.
Yep.
Awesome. Yeah, I heard something the other day about the NPS of healthcare, just being it's pretty low. So lots of opportunity for disruption and improvement. So excited to get into it. So Wendy, you've had a career doing all sorts of wonderful things, and they have led you here to co-found this company. And I'm curious to hear about what kind of led you to do this, and among all the other things that you could do. Why MiSalud? Why right now?
I'll start with the why right now. Why right now really came with COVID. With the stats out there, especially within the United States, if you are Latinx, you were 5 times more likely to catch COVID than any other American. And once you caught COVID, you were 3x more likely to die from COVID than any other American. And those stats, they're astounding, but they're also not new. Not new meaning we continue to see that communities like the Latinx community being negatively impacted when it comes to health issues, things like the pandemic. And we're seeing it again right now, even with monkeypox. For example, I'm in San Francisco, and they just released some stats around the fact that I think they said 15% of the population in San Francisco is Latinx, but 65% plus of the cases of monkeypox are within the Latinx community. So that health inequity continues to show itself over and over again, whether it's diabetes, chronic health issues like hypertension, whatnot. But it just became the time and the place to do something about it on the kind of outside. And then on the kind of internal view for me, I have been working with teams and building companies and teams and products in Guadalajara, Mexico since 2008. And so I've spent many years living there, many years going back and forth. And at this point, they're friends and family to me. So I wanted to bring folks together and actually build something that impacted their friends and family. And so we got together and we started talking about a lot of the different perspectives that my colleagues, product designers, engineers have in Mexico about healthcare in the US and about the US in general. Everything's supposed to be better here, right? But in the time that I lived in Mexico, it was incredible how healthcare, even as a privileged tech worker like myself, like healthcare is pretty easy. It's usually covered very well by my tech companies. But when I was sick in Mexico, I could just go to a nice hospital and get really good care, and there's no wait time. But of course, that again was a privilege of my being able to afford that. But coming into the US for a lot of my colleagues, even as tech workers and visitors who have tech jobs, they're just completely blown away by how terrible it is here. Yeah. Some of them have lived in the US for a couple of months or a couple of years as students or workers, and just being able to get care and suddenly getting like a $700 bill because you walked into urgent care because your kid was sick, like that's incredibly shocking. So we got together and decided let's help the people that we know, the people that we're connected to, and see what good we can do, especially in this time of need where the need continues to surface with all the data around pandemic. And as I mentioned again, like now with monkeypox and all the multitudes of variants that continue coming with COVID.
Yeah. And so we're at the time where you sort of shopping around for an idea of a problem you want to identify and solve, or was it more, this is a problem, I can help solve it, let's go start a company?
Definitely the latter, because at the time I was also working at Amazon, doing something kind of like vaguely related. I had started the Amazon apprenticeship program, and it was really focused in on gatekeeping and opening doors for people who didn't have traditional, like, oh, you didn't go to University of Washington or Stanford with an HCI degree. Like, how do you open the doors into UX? And at Amazon, we did that, but the approach ended up to be folks who didn't even have that advantage of doing a boot camp. people who are coming from, their Amazon warehouse, hourly worker statuses, or coming in from, hey, I've always been interested in design, but I work at a grocery store, or I'm interested in design, and the closest I get to it is I'm a makeup artist at Sephora. So people with different kind of jobs and livelihoods, but many of them ended up happening to be BIPOC, and opening those doors. So I would say when I look back at a thread of all the different things I've done, kind of trying to build equitable teams to build better products for the people that use them has been a thread in that.
Mm-hmm. Mm-hmm.
Nice.
Wonderful.
The data you shared is very, damning and compelling, right? Of 3 to 5x like worse outcomes in these different dimensions. So the problem there feels very like real and acute. But I'd imagine as you try to go figure out like how do we go help and add value and try to make some progress on this, probably a lot of research to unpack because it seems like such a multifaceted problem with so many dimensions. Like how do you actually then go from that being like there's a mission here worth doing and there's a problem here worth solving to like how do we actually help and solve it a little bit?
Yeah, part of that had to do with the unique model we have at MiSalud, which that's not part of research, so I'm just going to skip over that. But we have a unique model that helps solve some of the other data that exists in the US, which is 25% of US Americans basically are of Hispanic origin. So that doesn't mean they all speak Spanish, because you could be first generation, second generation, where you're more English dominant and maybe you speak casually to your parents in Spanish. I'm exactly that kind of person, but in Chinese. Like English is clearly my dominant language, but when I speak to my parents, I speak to them in Chinese, and I'm pretty good like conversational. And so I see a lot of Latinx folks kind of like my generation who have this exact need where we're still translating for our parents. We're picking up those health bills, those medical bills. We're helping them understand how to make those appointments. And that need, I guess, my understanding empathy for it is outside the barrier of, I don't speak Spanish to my parents, obviously, but being able to have a very relatable, empathetic experience of many of us first-gen immigrants, we do exactly this for our parents, and we'll continue to do it. And then we're writing this kind of bridge with our generation under us. If our children are bilingual or monolingual, we continue to kind of be that bridge with our elder generation. So it seemed like something that was easy to approach for me because I have that experience. But when it came to really understanding a lot more of the nuances of our community in terms of documentation status, needing different medical needs. For example, one of the things we discovered early on, like any telehealth app, here's a list of symptoms you can come in with, or you're just in pain and tell us the level of pain. Something that actually popped up last fall when we were in our open beta was a lot of folks were coming in. They knew what they had. They said, look, this is just a cold, or I've just injured my arm. This is normal because I lift boxes all day. I just need a medical note from a doctor to excuse me from work. Otherwise, I get fired. You and me, we're tech workers. Don't feel good today? Let me clear my calendar, email some people, set my away status on Slack, all good. But when we're talking about our hourly wage workers in the community that largely sits in that space, they actually need a medical note to actually prove you're really sick. So that actually became one of our top trends in the winter when a lot of people had colds, potentially COVID, and needed to come in for that quick, understandable medical note from somebody who could understand them without having to go stand in line at a local clinic or try to make an appointment with your doctor 2 weeks later when you're not sick anymore. So being able to have access to that in your language with people who were really trying to understand and help you, I think made a big difference initially. And so a lot of our learnings and how we approached just came from talking to our community. One of the early things we did, sorry, I'm monologuing here. I'm just going to
you're good. You're good. Yeah, keep going. One of the early things you did.
Yeah, one of the early things we did was we actually went out and set up booths for example, in San Jose, large Latino community. There are supermarkets and entire malls that are Hispanic focused. So there's one called La Tropicana. It's in San Jose, and everything in that mall, from the hairstylist to the gift shop to the kid shop to the giant supermarket there, which is called Tropicana, everything's in Spanish. And when you go there, it really feels like you're in Mexico. Humorously, basically 2 blocks down the road, there is the Vietnamese version of that, because San Jose also has a large Vietnamese community, which is exactly the same, but everything's in Vietnamese. So there are these pockets. And so we showed up there. We had a booth inside the supermarket on the weekends, and we're handing out flyers, getting people to come talk to us about MiSalud. And many folks, MiSalud means my health in Spanish. So many folks kind of got the idea of what we're doing. They're like, okay, this is in Spanish though. Who are you and what are you doing? And we told them you can get free consultations with Spanish-speaking doctors, like here and now, right on your phone. You don't need insurance. You don't need to pre-fill any personal information. You can just come in and have a call. And during those situations, we learned, a couple of things we already knew about, but really got to get personal with people about, well, can I sign up if, I don't have an ID? And we're like, what do you mean you don't have an ID? And basically people started kind of intimating that they're undocumented. So what's it going to look like if I work with the service and I need a prescription or I need a lab test? So we were able to help kind of alleviate those concerns and show them how, especially in California, you're able to get a lot of this care without identification. And then we started learning more about the actual users and the use cases. Again, you and I are in tech. If we were to design a mobile app, yeah, sure, we're going to design it for you and me. We know how to download an app. We know our email addresses. So some of probably the most shocking things for our team early on as lessons learned were when you log in a healthcare app, you need two-factor authentication, email address, SMS code, or email and password and SMS code. Many of the people that we met in the grocery stores who try to sign up would struggle with the first step of, I think I have an email somewhere. Can you help me find it? I can't remember what the email address is. And we're like, uh-oh, this is a problem. And then we would have people say, okay, great, now we're on the phone number step. I don't actually know my phone number because I never call anyone. How do I find it on my iPhone? And so we would actually have to go through all these extra steps of, hey, you're on your phone. Here's how you find out your email. Here's how you find out your phone number. Here is a recommendation of how you create a secure password, uppercase, lowercase, numbers, symbols, etc. And honestly, every single person, they just wrote it down on a Post-it note and put it in their pocket or their purse. Sure. So it's a totally different community of tech savviness that we had to kind of learn in person.
I was going to say, you learned this in person. Was this at the shopping mall or over time? I'm curious about how much learning and discovery did you do before you launched the app? And obviously you're continuing to do a ton since you've launched.
Yep. So we actually didn't do that much learning and discovery before we launched the app. That's always the struggle of a startup. Do you chicken it or do you egg it? Which one goes first? So we made a hypothesis. And we built an app that, again, works for you and me, like normal tech savvy level. We put it out there. And then when we were in person with folks in the grocery stores, we did this for probably about 2 months every weekend. And then we also had some partners and friendlies who ran restaurants in the Bay Area and LA where we were able to go in and offer this to their employees and train their employees about how you install and do these things and answer their questions live. We basically saw the same trend. In kind of lower tech savviness, a lot of secondhand phones from the children that were, parental lock is supposed to be for your kids. A lot of people do parental lock and give it to their parents. They're like, you're not going to accidentally buy or download stuff. So we learned a lot in person, but I think it was super helpful for us to have an initial hypothesis, have built out the first version of the app, and was able to use that in person with people. Like this was definitely something with the tech savvy level of our community, we wouldn't have been able to paper prototype them or have conversations about it. We'd actually have to see them struggle, seeing how people were kind of like poking around their keyboard like, like let me go ahead and type this on my phone, one-fingered. Folks who continuously dropped their phone because they had arthritis and it was difficult for them to use certain keyboards or certain elements within the app, and having to make things super obvious. So I think as a startup, we had to definitely build something to really see the pain that people were going through in utilizing the technology. But also, once we did go out there, we just continued to talk to people and continued to observe. And we even had situations where, somebody would come talk to us at the grocery store booth and want to do their health call right then and there. And we're kind of looking around, we're like, you might want a little more private space. Like maybe go to your car and do this, and maybe we'll come with you and kind of help you set up and observe and kind of see how even people, because we're on demand as well as scheduled, seeing how people came into the app and would just kind of scroll through like, I'm an older woman in my 50s. I'm looking for somebody older as well. who's more my contemporary, because I'll trust them more. Versus, younger women in their 20s would say, I definitely want a woman doctor, but I definitely want somebody more my contemporary who's not going to judge me about the things that are going on with my health. So it was also interesting to kind of see that, which is very typical in healthcare, but also see how much more it mattered to our community members, being able to see like, oh, I'm going to talk to Dr. Liz. She's from Mexico City. I'm also from Mexico City, or my mother's also from Mexico City. There's like an affinity there already.
You touched on this a little about like, hey, you're about to have a sensitive conversation, maybe go to the car or something like that. Just more broadly, as you were doing research here, how did you make sure that you were handling, the sensitivity that comes with health information correctly? Like, did you have to get consent, or how are you doing that with people to make sure that it was something that was comfortable for people and allowed you to get the insights you needed?
Yeah, so everything that we were doing was HIPAA compliant, the way the platform was built. We would not involve ourselves when those consultations started. I remember going with somebody to their car, helping them set up and choose the consultation, saying yes to camera and mic permissions, and then they're still there. They're like, oh no, don't leave. I'm like, oh no, I'm going to close your car door. I don't need to hear this. Like, make sure our team understands that boundary of personal health information and where we need to step away. We also see the same on our customer support side. You would think it's clear. Customer support is your tech issues. How do I get a subscription? How do I, get a help if I'm in a different state other than California? Instead, coming in through our helpline a lot is, hey, here's a photo of this condition. Can you tell me what it is? It's like, oh, no, we don't need to see that. So, for example, in our research, we found a lot of folks just wanted to drop in and have that text conversation right here and then. They don't always want to be on a video call. They don't always want to do an audio call. But a text is a nice, safe place to start for them to build trust. And we actually ended up launching earlier this year a chat directly with our coaches and doctors. So you can actually start the conversation there. And our coaches and doctors found that there were many simple things that they can help address, like, oh, I have this headache or I have this sinus issue. Okay, well, you should go get some over the counter and try it for a few days. Come back and let us know if it gets better or if it doesn't. But there are just some things where, somebody might be talking about a rash or something like, hey, can you just go into the app and actually start a video call? Like, I need to see that. I can't continue texting you about it. So there are different ways to get people comfortable with sharing the information. And then as you build that trust of, we're talking about something I visibly have to see. Can we do that video telehealth call now? And so that was kind of the little bridges we had to build of, you've heard about the service. You can chat with somebody who seems like they're a real doctor. You don't know if they are, though. And then as they continue to kind of diagnose and work with you, you can actually jump into those video calls. A lot of our folks actually just start with the video call, but there are definitely folks, for whatever reason, privacy, security, lack of trust, always want to start with chat.
I'm curious because you have what, chat, SMS, video, on demand, not on demand, right? All these different sort of modalities of interacting with care. And you, on the business side, on the research side, can't be there, as you said, in the car during there are moments in the journey you're not allowed to be there, part of. How do you close the gap on that journey and understand where you're improving, where there are opportunities, not being able to sort of be there as part of all of it?
That is where we have a unique advantage. So all of our health coaches and doctors work for us full time. So we're able to have conversations internally with our medical team to really understand, what are you seeing and hearing when it comes to ease of use? Are you seeing a lot of people doing that video thing where it's like, no, my finger's like right in the video because I'm holding it on my phone? Or are you seeing people constantly accidentally dropping off? So in the early days, we did see a lot of people accidentally dropping off their calls. And what we learned was, they're going to tap on that WhatsApp message that's popping in, even though they're in the middle of a video conversation with you.
Right.
Yeah, right. And once they move to another app, it actually hangs up on the call. So then we had to continue to learn and adjust from there. We keep your call continuously open for 2 to 3 extra minutes if you leave the app, and then you can come right back in. And your doctor or your coach is still there waiting for you. So we had to kind of learn on the go, but it wasn't just experiencing it from talking to people in person at the grocery stores, or actually talking to our coaches and doctors to see how this worked out. We actually did some dedicated research twice. I would actually say 3 times. 3 times within the first year. So the first was me talking to friends, neighbors, and then at some point I live by a grocery outlet. I live in a heavily Hispanic neighborhood here in San Francisco. I went to grocery outlet and I basically bought $10 gift cards and kind of stood around and said, hey, you're leaving grocery outlet. If you talk to me for 5 minutes, I'll give you this $10 gift card. And I would just ask them, like, do you go to the doctor? How do you go to the doctor? What do you see them for? And having these casual conversations in person, and I was doing it in Spanish in a parking lot, and I think that bought me a lot of credibility because they're looking at me like, why does this not Hispanic person want to talk to me about something? But being able to do that in person, it built credibility, and actually a couple of the ladies that I did speak to coming out of grocery outlet ended up, one of them actually insisted on taking me home with her, and I was like, okay. And it ended up because she wanted me to read her medical bill and help her understand it. But she actually showed me some of the things that she did have at home. So she had her Amwell, which is a big telehealth service, sticker on the magnet on the fridge, and then she actually had written out directions that one of her children had written out for her, like open your phone, click on the app that's yellow and blue, and then do this and start the consultation, make sure it's in Spanish. And so it was really interesting to see how people addressed healthcare and some people who didn't. And what all of this research did for us was it kind of helped us create an axis. And the axis that we did was on the x-axis side, we had basically put the range of English dominant to Spanish dominant and kind of where each user was on the range. And then on our y-axis, we had something called reactive and preventative. So I think you and I are probably more attuned to what preventative care is. We understand the concept. We've grown up with the idea of primary care providers. You do your annual exams as a, male and female, and you have those normal things that you go check for, like pap smears, breast cancer, 40 plus. They're pretty common to us. We know this growing up, and we're not super attuned to healthcare. But when we're talking about our community, which has very much been underserved, they go to the emergency room and urgent care when something is super wrong. Like, my arm is bleeding. I've been out of work for 4 days now. Like, this is really bad. I need to go see someone. And so once they go there, it's very much a reactive condition of there's something wrong with me right now. But they never address the preventative because it's expensive, it's out of reach, maybe it's not in their language, or they just don't know how to with either the insurance they do or do not have, or in the locations they are. So it becomes this axis that we ended up seeing on this quadrant. A lot of people were sitting up on the reactive side. And then so when we took a look at what we would need to build based on reactive and looking at other telehealth platforms, those telehealth platforms are for the usual. Like, I use One Medical, I guess now Amazon. And with One Medical, I just go in and everything's geared towards, are you here for your annual exam? Refill a prescription, a cold, a pain, or, did you receive some sort of viral infection or anything else going on, or do you need vaccines? And so those are my options when I go to One Medical. But what we needed to do to really encourage less reactive and more preventive shift in mentality is when you go into our app now, you can see everything from big to small, your chronic health conditions, medications, whatnot. But also you can come in for something as simple as allergies. Like, my nose is runny all the time. I don't think it's COVID. I think I have allergies. Like, I didn't know I can treat and prescribe for that. A lot of folks that we've talked to don't know that they have allergy medicine that actually resolves, the itchy, watery eyes. They hadn't ever thought to talk to somebody about that because it wasn't that big of an issue. It's just, no, that's just something I live with. And so being able to offer this range of topics all the way down to you're just in pain. You don't know what it is. You don't have to know what it is. It's our job to know what it is. You just have a pain. Give us your pain scale and come talk to somebody. And then we'll go figure it out together.
It sounds a little bit there like you're actually trying to be interested to hear the vision, the mission for your company in your own words, but trying to actually change behavior, not necessarily to meet a stated need, right? I have a bleeding arm and I want to get back to work, and we're going to make that easy for you. But also, we think this would be in the best interest of the community we're trying to serve if we made, brought up some awareness here and made it easier for them. Is that the case? And is that
exactly
part of your sort of mission? Yeah.
Yeah, our mission is to help the community evolve kind of their current understanding of health, whether it is on the more mature side, you're already in preventative care because you've always had a great salary job and great health insurance, or if you're kind of new to healthcare, maybe even new to the US, and you need to figure out, how am I supposed to get care for these things? So we want to offer that range and meet people where they are and slowly educate them forward.
Right.
And we think that's incredibly important. Back to the original stats of, diabetes, hypertension, all of that is super pervasive within the community. Especially if you're Latinx, you have a lot more chance of getting diabetes in your lifetime than an average American. So how do we change those habits from the beginning? And so I have mentioned health coach a couple of times, but haven't clarified that. So we actually have the model where we do work with health coaches. So our health coaches are actually licensed physicians in Mexico, because this model for us wouldn't work, because the US has one single problem, which is 25% Hispanic, 6% and less of doctors actually speak Spanish. So there's no way that we'll ever close that gap. And so we have to look for folks who can meet them where they are in terms of language. And that for us resulted in hiring LATAM physicians who are licensed in their countries and working with our US-based, in this case California-based patients, as health coaches. We call them health coaches, Coach de Salud, because they're clearly not licensed in the US, so they're not going to be doing medical diagnoses. But we're seeing about 75% of people coming in with situations that can be addressed with, take some over-the-counter medication, improve your diet or your sleep or your habits in this way. We also offer mental health services. So when people come in, and there's a big stigma still with the community when it comes to mental health. Nobody's going to come in and actually say, I need mental health help. But they do resonate with seeing, hey, I'm having trouble sleeping. I'm really nervous about things all the time. I'm super stressed out by work. I'm having relationship issues. Those are typically signs and symptoms where we can bring them into a mental health conversation with our mental health coaches, who, in a similar way, are fully licensed psychologists in Latin America, and they chat with our patients here as mental health coaches. So a lot of it, when we think of coaching also, we're thinking of lifestyle medicine, which is, let's help you build healthier habits to change that. Like, you can manage your diabetes and help lower your A1C level for diabetes with better habits in eating, in sleeping, and exercise. I'm not saying, oh, you can make your diabetes disappear without medicine, but you can help manage it and make it much more manageable and livable in certain modalities with health coaching.
Mm-hmm.
Nice, that's clever. You mentioned earlier about the dynamic of wanting a doctor or a health professional that has some commonalities with your identity, right? So maybe age or background or where they're from, and that being really important to building that trust and feeling comfortable. And then you also kind of called out when you were grabbing people outside that supermarket and kind of earning credibility because you knew Spanish and were there and being honest about it. Like, what would your advice be to researchers who are doing research with a population that has a different identity than themselves and is maybe talking about sensitive stuff? Like, how do you build that rapport and build trust in those types of situations?
Yep. One of the things that really worked for me, even though I spoke Spanish initially, people were super wary. I actually had one lady say to me within the first 2 or 3 sentences of our conversation, do you work for the government? Are you just here to find out if I'm documented? And I was like, whoa, okay, right, I need to back up and find a new way to approach it. And so one of the things that I found helpful was just to really start with talking to folks about hey, so I used to work in this company in Mexico. And during that time, I've been all over Mexico, and clearly, you're also Mexican. Where are you from? And somebody might tell me something like, oh, I'm from Cuernavaca. I was like, awesome. I've actually been to the mines in Cuernavaca, and start talking to them and really trying to build something relational right there. Or I might try to really cue in on, they're walking out of a grocery outlet. What have they bought? Okay, she's clearly here and she's going to make enchiladas tonight. So let me talk about enchiladas with her and ask her for her best tomatillo recipe. And so it's really going to be situational. And I think at core, when I look at my teams and talk about research, I'm looking for somebody who has curiosity and empathy and can lead those conversations, but also they can read the room. They can read the situation and they know how to redirect that. And I think that's probably just as important as being able to be scripted and prepared, because you can have everything kind of checklisted out for you, but until you walk into the real situation, where I was incredibly taken aback by, are you with the government? Like, let me see your ID. And I was like, I will happily show you my ID. You don't need to show me anything. Like, I'm just a like weird normal person who just wants to talk about healthcare in Spanish with you in a parking lot. And so it's reading those situations and how to approach that. I certainly had several people turn me down. I'm not saying I was successfully talking to every single person I tried to stop. And I would say what I noticed is several things. Women wanted to talk to me more. Men just, in general, we also noticed this throughout all of our research. Men just didn't want to talk about health. They're like, yeah, I'm not worried about that. Like, my mom takes care of it, or my wife takes care of it, and then somebody schedules for me. It makes me wonder about the young single men who aren't living with their moms, because who's taking care of it for you? But basically, women want to talk to me more, and then so we also put together small groups where we had some of our male colleagues go out, and yeah, men talk to them more. So you have to kind of see and meet people where they are and with who they are, and kind of the mentality.
Mm-hmm, mm-hmm. You talked a little bit before about the importance of building equitable teams. What does that look like at your current company? How have you worked to do that?
Yeah, so our current team, we are a bilingual app and service. So everybody has to speak Spanish and English. So that's a start. A large portion, because I have worked in Mexico in tech for a long time, a large portion of our engineering and design team, they are coming from Guadalajara or Mexico City. And what we have found super interesting, and this is not because we tried to, this just happens so to turn out this way, is a lot of our engineers are married to doctors. So their partners are doctors, and so they come in with not only an affinity of like, oh yeah, my aunt, she lives in Los Angeles and this is totally going to be helpful for her, but also like, oh, but my partner is an ophthalmologist or a surgeon or a pediatrician, and would be really interesting to bring them in this model, because I hear from them about how the platforms they use when they're doing telehealth are incredibly painful. It's not helping the right people and all these other things. So they're already coming in with the things they've heard from their partner of like, oh, I have ideas about how these platforms work. As we continue to build them. So that's been really interesting. But on the equitable side, a lot of what I intend to continue hiring, we are a startup. This is the economy that is the current economy. So as we continue to grow and scale, what I would like to do is continue to hire more folks with that lived experience in the US. So our head of marketing and growth, he is Latino. He moved here from Mexico 20 years ago, and one of the first things I saw in his resume when we had a conversation and interview was, hey, you went to the University of Guadalajara. That's really exciting. Like, I've given lectures there on UX. And so like, I totally know that school. It's so awesome that you went there. And he told me, as a Latino living in LA and having been a professional here for so many years, he's like, you're the first person who's actually seen my having a degree in Mexico as a positive. Everybody else is like, I've never heard of that school. It's not a US school. Like, your education doesn't count. So trying to find people with the lived experiences and the journey that they have is incredibly important, because they can lend a lot more to us that helps us get ahead of the research, helps us get ahead of the what's coming next. So, for example, I know his father is probably one of our early promoters. He was always coming in the platform, and he would always tell us how happy his dad was utilizing MiSalud. But he would actually have to do the same thing, which was I had to set up the app for my dad, get all the way in the call, and then hand it off and walk away.
That's cool. Yep. You touched on it a little, but like the reality, it feels like, of our system or healthcare in general at the moment is that the people working in healthcare, the doctors and everyone else, and also have kind of a tough time with some of these platforms and the way the system works, and then the people who want care, and it's kind of this unfortunate mismatch. Are you also doing research with people like the providers on the platform and getting their input and stuff? How do you do that? Because it feels a little different, right? You can't just go to a supermarket and find doctors who are using your apps. Are you going out to them in a different way? And what sort of stuff do you hear from them?
Yeah, so we actually, before we started building the platform, we had several advisors and investors who were doctors, are doctors, I guess. And we actually asked them for their experiences on other telehealth platforms. Of course, they're all confidential, so some of them were able to just kind of tell us about things that were useful. And others would kind of point out, things that were missing that made their life a pain. So that kind of gave us our first initial ideation on, what the other platforms look like out there. And then the next step we had was, because we have all the coaches and doctors that work for us, we actually just set up regular, it's on the calendar. We just rotate through the staff and just go in, and basically I'll call in as a fake patient. And then the design team is on Zoom screen share with them, looking at them in the doctor portal and just observing, almost ethnography, except we can't really be in their environment. Everybody's still kind of remote and COVID-y. So we just kind of see how they use the platform. Like, I'll actually just go through some of our fake health conditions and talk through it with them, and just kind of seeing interesting things like, hey, we noticed that when you were screen sharing, like, you made your window really small. Why do you do that? And they're like, oh, because I have a Google Doc over here of the over-the-counter medications that are available in the US, and I want to be able to look at that list when I realized that you had an allergy. So what can I tell her is over-the-counter she can pick up? So they're like, I just made the window smaller so that I had another window with the medication list over here. And we're like, interesting. So we should build that into the app rather than having you like squeeze the window and kind of have the video view that we're all having of like parts of our faces.
Right.
So able to really see them utilize it in this kind of realish way, while also hearing from our coaches and doctors the types of questions that they're also hearing from the patients in terms of, okay, what's next? Like, where do I see that prescription in the app? For somebody who's not super tech fluent, like, okay, so after this call ends, it's on the bottom of the screen. We are thinking about things like, are there ways for us to be able to have push notifications that the coach or the doctor can trigger so that the user has an easier time? Like, okay, you get the push notification. Prescription's ready, tap on this. It's going to deep link you into the app on where your prescription and pharmacy is. So being able to do things a little more manual, that if you think push notification, you would never think that we should allow coaches and doctors to have that power. But we're thinking that could be really interesting because they can really help the patient complete their health journey in that situation by offering that kind of deep linking or call out through push notification.
Yeah, especially so for an audience that's having, some challenges with tech, just tap and yeah.
But it's not just the patients. I'll throw out one other thing. The coaches and doctors, they're not tech workers. They're not tech savvy. So this is also something where we have to meet them. And the way I like to think about it is our goal should be to develop an invisible layer of technology that just helps two people get together and improve their health. So in the back end, our technology should not be in the forefront blocking anybody. It shouldn't be difficult to navigate. And one of the things that we've learned in talking to my co-founder, he's also an ex-surgeon, is everything in our current medical system today, when you go to the doctor or the hospital, it was built for billing your insurance. It wasn't built for your care, Aaron, or your care, JH. It was built for, how do I line item every single thing I just did here when I give you a vaccine, from opening the needle package to disposing the needle to disposing the vaccine little vial, and then even putting a Band-Aid on you. Everything is line items so I can bill your insurance for it. It's not built for the doctor to say, hey, this is going to give me the most holistic care for Erin so I can help her into the future manage what vaccine she needs to take when she travels to whatever country. It was built just to make money.
Yeah.
And so one of the things I would like to have continue to have pride in as we go forward is we don't work with insurance. Many of our community, they're underinsured anyway. So we would rather just build something that helps enable the doctor and patient care and not worry about how we're making money. Of course, that is a privilege we have as a venture funded startup. But that's something that we'll continue growing to and figuring out as we go along. Like, one day we'll work with billers and payers, but that is not today. And today, everything we've built is for that doctor and coach to speak to that patient and have a holistic view about their care if they keep coming in with the same symptoms.
Yeah. I'm curious along the lines of, how do you monetize eventually, which is a problem for tomorrow, is a great VC-backed, company, as you mentioned. But you talked about the matrix earlier, right? You have the matrix of sort of Spanish, English fluency, and then the reactive sort of preventative. And we've talked a lot about, from what I gather, more the Spanish speaking, reactive, and maybe lower on the sort of economic sort of scale as well. Do you have many customers outside of that, customers that would be willing to pay, that speak a lot of English, that are more preventative, kind of on the other side of things? And if so, how are you serving them at the same time as these other customers?
Yeah, and that's always going to be a fun situation for us to consider as we build forward, is exactly what basically any other designer has to deal with, is how do I build for the pro user and how do I build for the new user? And in that case, that's basically the same mentality. New user being lower tech, pro user being like, just get me in that consultation video call. Like, I don't need to worry about all of this other stuff. So we do have users like that. And actually, one segment of that group is super interesting. It is actually tech workers in Mexico. So we actually offer our service to companies in Mexico. And they tend to be tech companies because a lot of their employees travel to the US. And maybe when you're in the US, you get food poisoning. And then you want to call a doctor, but you're not from the US. How do you actually get care? And so we offer MiSalud for that contingency as well. And it has been super useful for them, but it's also something that we continue to consider is, how do we research and kind of balance their needs? So for example, when it comes to our lower tech savvy patients, they come in and they do their username, password, and then their two-factor authentication. When it comes to our more tech savvy users, they want to use their Google or their Facebook or their whatever single sign-on and just get it over with, and have that ease of use. And so we do see people come in and continue to sign up through their Google Auth. It's like, nope, this time you used your work email. Nope, that time you used your personal email. And now you have two different medical records. Like, how do we help you merge those? So those are things that we're learning from our users, is when they sign up, for example, one of these Mexican tech companies, they all signed up with their work email because you're enrolling through your company. But then when they all came in to actually do their mental health consultations or health consultations, they used their personal email. And then we realized there was kind of this mental gap for them of just like, yeah, I don't want to log in with my work email because I didn't want my work to somehow access this. And we're like, they wouldn't access this. So even if you're tech savvy and you kind of understand the system, we find that people are still concerned about security and privacy of information. They're, to put it this way, and righteously so, because I'll use this word because I feel this way, I'm paranoid about where my health information goes, especially as a woman in this country in day and age right now. Yeah. So I would have those same concerns, is I want to use that one private personal email and not have anything linked to my my work emails, even though work pays for my insurance.
Right. Well, forward looking, what are you, you have a mission and your early days in your app, and you've got some users and some research and moving forward. What are you excited about? What do you hope to sort of contribute to health tech?
Well, there's probably two things I'm most excited about contributing to as we continue to grow and get more patient information, and we can kind of drop that in a mega data lake and anonymize it. Nobody's ever actually come out with a Hispanic Health Index report. Nobody's actually come out with a wide range of information about, for example, Hispanics in California and what conditions we're seeing, how we can continue to improve care, and if we can measurably have made change through shifting the mindset and mental model towards more preventative rather than reactive, and what that looks like. I would love to, over time, have data to be able to show that and prove that, and interest other practitioners in that kind of model of, we're not just here to be reactive and solve people's problems, but how do we actually take a preventative measure forward and kind of change the mentality of how doctors approach their patients and help them with everything beyond the right now issue that you're trying to bill for. So I would love to be able to one day provide a report that shows that this works and have folks be able to approach communities this way. And then on the other side, I am incredibly excited about our opportunity to reach out to large employers of large Latinx employees. So, for example, there's a lot of agriculture in Florida. that happens. And I would love to work with those employers to offer something to their employees rather than, hey, I'm going to give you something like Kaiser, but you have to pay $1,300 a month yourself for it. So being able to offer something a little more low cost, that's much more accessible and culturally appropriate to the care that people need, I think that's going to be something that hopefully translates well when it comes as an offering from an employer, not just right now we're kind of B2C and you can find us in an app store, you can find us at the grocery store. But if we can work with these employers who are offering something that can actually shift and impact their employees' health and, you know, of course, to the employers, their productivity, I think that is a positive add, that it becomes a norm that your employer should be offering services that meet you at where you are.
Totally.
Wendy, what did we miss? And what do you want our listeners to know?
Well, I'll point this out. I realize that I've talked a lot less in deep dive about research and how we do it, and you know we're touching on people. But I think the important takeaway here is we didn't approach this as a research project. We really wanted to understand our community, and when you approach, in particular, underserved communities, and you're trying to do research with them, you have to really meet them where they are. We wouldn't have succeeded with one of our studies, which was based off D-Scout, because with D-Scout, all of the people we talked on there, they were already on D-Scout, ready to get compensated, and ready to use the technology to have a conversation with us. Right. That would have, if we had only run with that D-Scout study, which we ran, we would have assumed everybody was tech savvy and we would have just built that forever. Right. You have to actually meet people where they are. Like, do the real ethnography. Go to the places that people are living, in the environments they're doing the things you need them to do, and get to know them and build that trust. You don't need to talk to 200 of the people. Honestly, I've only been in 5 people's homes at this point who invited me to come help them or learn more, mostly help them. But those relationships live on. They're all in my neighborhood, and these ladies still call me, and I'm like, I'm traveling a bit, just take a picture of the letter for me and I'll tell you what it says. So I think I've kind of pseudo gotten adopted because I also get a ton of tamales all the time on my doorstep because of that. But meet people where they are and just be real, and you could actually build really great relationships that extend beyond the research. And for me, I'll continue reaching out to the ladies in my neighborhood because they're ones that I'll want to talk to when we build a diabetes program and when we build, you know, a menopause program. So I think these are relationships worth considering beyond here's the interview, we're done.
Yeah.
Totally. You know, I thought what really came through in the way you spoke to all this was you had so many examples of like a thing you learned and something you could improve as a result of it that just felt so tangible. And I think sometimes, as you kind of flag, some people, when they come to the research, they lean into telling all about the methodology or the tool or whatever, which is also interesting and important, but really cool to hear the stories of, we found the right people in the right situation and we learned this sort of nuanced thing and we fixed it. And I think that's really like the reason for doing it in the first place. So it's great to hear those stories. Exactly. Work with your designers. In our case, all our designers are also researchers, so we kind of have that hybrid. But if you have dedicated research teams, get close to your designers. Figure out how you can actually ideate solutions that will meet the people with what they need. Yeah. And we'll also post your LinkedIn and Twitter, so anyone listening with medical bill questions can just ask you directly, Wendy, because I know that's your new side hustle. Yeah, exactly. I'll trade for tamales. I'll translate for tamales. All right. Sounds good. Thanks for joining us, Wendy. It's been great to have you. All right. Have a good one.